Dr. Angela Cherniawski, Grand Blanc Chiropractic. My office is on Saginaw and McCandlish. My website is grandblancchiropractic.com. I specialize in short-term care for neck and back pain. I get you in, get you feeling better, and get you out as quickly as possible. Today, we're going to talk about 3 things. How to prevent low back pain, home care if you already have low back pain, and chiropractic care for low back pain if you need it. So what do you think is the easiest or the number 1 or best way to prevent low back pain?
Don't wear a gun belt.
Don't wear a gun belt. Anybody else?
Stretch.
Stretching is good. Something else?
Proper form.
Proper form is good. I'm just going to help you guys out and say activity, walking especially. Just that action of swinging the hips when you walk keeps that low back loose and limber. The fact is that we live in a society where we do a lot of sitting. We sit in our cars, we sit at the dining room table, we sit to watch TV, we sit at our desks and our computers. So staying active is key because sitting puts a lot of pressure on the low back. But on the other hand, you don't want to overdo activity. So having proper form, for example, when you're lifting. We all know, bend with the knees, lift with the legs, because the thigh muscles and the glutes are the strongest muscles we have. There's one more thing though to consider. Quick survey, has anybody watched or will watch a Little League baseball or softball game this summer? Okay, a few of you. So I have a homework assignment. I want you to go out and look at the kids on the field. I can predict which kids either already have back pain or will develop back pain based on their posture. So they're on the field, their knees are bent, they're ready to field the ball. Some of them are like this, and some of them are like this. Which is the better position? A or B?
B.
B for sure. The more you round your back, the more pressure you put on the vertebra and the disc. So keeping a flat back, bending with the knees, lifting with the legs. You don't want to overdo activity. So if you're doing a lot of lifting, for example, ask for help. If you're doing a lot of yard work, for example, do some work, take a break, do some stretching, take a rest, take a walk, and then continue on to do the work. How about sleeping at nighttime? What's the best position to sleep in? Back or side. Good. If you sleep on your back, soft pillow under your head, pillow underneath your knees with your knees slightly bent, it helps to take pressure off the low back. If you're a side sleeper, sleep with a firm pillow under your head and another pillow in between your knees. That helps to keep the pelvis perpendicular to the mattress when you sleep, to keep your spine in proper alignment. Preventing low back pain. If you already have low back pain, these things can help as well. Walking, avoiding overactivity, sleeping with the pillow under or between the knees are all good things. What about ice and heat? Which one for low back pain? It's a trick question. Both, and it depends on the situation. If you have back pain that you describe as a 7 or above on a 0 to 10 scale, if you describe it as severe, burning, sharp or shooting, ice it to numb it. If, however, you describe your low back pain as moderate, 4 to 6 on a pain scale, achy, muscular, or stiff, then you want to heat it to relax it. There's 2 types of heat, dry and moist. Dry heat is like the heating pad you plug into a wall or the heat on your car seats. That heats the skin. Moist heat is what penetrates for the therapeutic benefit. So like a rice bag, for example, or any kind of heating pad that has a dry material in it, like clay, you put it in the microwave, it absorbs the moisture from the air so that when you microwave it, it releases it as steam. That's the best kind of heat you use. Whether you choose ice or heat, 30 minutes at a time. When in doubt, you can also alternate ice and heat as well. Any kind of muscle cream you have at home is also good. There are hundreds of them. All of them are pretty much the same. They're a blend of menthol and camphor. Menthol to cool, camphor to heat. Personal preference. If you like them, use them. Bring some to work, and that way you have something on hand with you. If you're having an ache or pain, you can use it right away for some topical relief. Lastly, doing some stretching. There are two kinds of stretches to do. There are stretches that you do in flexion, and then there are other stretches or exercises that you do in extension. What exercises or stretches do you think are better for the low back? Bending forward or extending backward? It's another trick question. Another trick. It depends. So let me move on to chiropractic. If all else fails, you already have low back pain, you've done the home stuff, now you need some extra help, that's where I come in. First thing I do is check, after asking you a series of questions, is check your range of motion and have you tell me what feels better and what feels worse. Does bending forward make it better or worse? Does bending backward make it better or worse? And from there, I can determine what kind of low back pain you have and make the proper recommendation for stretches. And that's the handout that I brought today. Gives the two sets of stretches, and the set of stretches that you use is depending on what feels good and what feels bad to you. So if going to the grocery store and leaning forward on the grocery cart feels really good, then you're gonna do stretches like knee to chest or bending forward to touch your toes. If you're kind of the person where stretching backwards feels really good to the low back, then you're gonna do stretches where you're on your belly on the floor and propping yourself upward, either on your elbows or your hands. And that's what that handout explains. Another thing I do during evaluation is a set of orthopedic and neurological tests to determine exactly where the pain is coming from, and then do a chiropractic adjustment. So quick raise of hands, who has been to a chiropractor before?
3 times last weekend.
Yeah, nice, I like that. I would say that's about half or maybe even a little more than half. Impressive. So there are hundreds of chiropractic techniques. There are some that are really slow and gentle. The biggest wimp that I have in my office right now is a retired police officer, no lie. I can barely put a pinky on him and he's in pain and scared, and I have to slow down,
Initials
nice
JC.
and gentle.
You must have worked at work.
But I also know that some of you like it rough, and that's where more aggressive treatments come into play. And I adjust all kinds of ways in my office. I have the gentle techniques, and then I have the more aggressive, forceful techniques. Everybody's different. It likely requires a variety of techniques to get your pain under control. The bottom line is you don't have to suffer. Do the home stuff for prevention and treatment, but by all means, if you have an issue or problem and you need some help, I'm right close by. Dr. Angela Cherniawski, Grand Blanc Chiropractic.